your brother, when he was 8 or 9, was had just been sick with the cold, and we took him into the doctor to get a strep test. And at that point, we had noticed that he had a lot of bruising over his legs and his body, and the doctor had took some blood work at that point and said he has the ITP, the juvenile version, which is, again, a rare platelet disorder, because his platelet count at that time was really low due to his immune system breaking down, and it went away, and with no treatment at that time. And again, it reoccurred, 10 years later when he went to college after he got sick, and his platelets tend to be on the lower side than normal, but he's not in any dangerous situation. He just has a very low affected immune system.
What does ITP stand for?
ITP is idiopathic thrombocytopenic purpura. It is a bleeding disorder where very few platelets are in the blood. Platelets allow the blood to stick together to form clots. In this particular case, idiopathic means unknown cause. They don't know why something in somebody's bloodstream begins to destroy the platelets. A test has been determined. The Adams 13 is an enzyme, they said, is present in the bloodstream for this diagnosis, and Fred had that enzyme, and for some reason that enzyme kind of turns into a Pac-Man and starts shredding his platelets to nothing. So in something like that can occur over periods of time, and in his case, his knees were swelling up, and the swelling wouldn't go away for several weeks. But when he collapsed and turned yellow, his kidneys and his liver was beginning to shut down because they could no longer coagulate the platelets as well.
What are platelets and why are they so important?
Well, they're the coagulators in your bloodstream. So in other words, if you didn't have any platelets and you cut yourself, you would bleed to death. Because usually what happens is your blood begins to clot, and that's what, when you apply pressure, your blood begins to clot and you stop bleeding. If you didn't have any platelets inside your bloodstream, you would just continue to bleed out, which is what was happening to your dad. And he was bleeding internally, and they were all landing into his knees. So that once he stabilized, they actually took 3 pints of blood out of his knees. That's how much blood had fallen into his kneecaps, into his knees.
So basically the gout actually saved him.
Yeah.
How did you find out that you had the ITP or TTP?
When I went to Mercy Hospital and they did some blood, they thought I may have this ITP. They weren't sure. But they sent me to the University of Colorado Hospital in Denver that does the majority of blood work. And that's where they diagnosed me with the Adams 13 and found that I have this ITP.
Exactly how deadly is this disease or blood disorder?
Well, what they told me when you and I arrived to the Denver University Hospital was that it's such a rare blood disorder that at best they see maybe 6 patients a year, and only in the last 5 years, 20% of them have survived. Typically, by the time the signs and symptoms show up, it's too late because the liver and kidneys have already been damaged. What saved your dad was the fact that the pain that he was experiencing the night of his collapse was not from so much the platelets, but from his knees, which had built up so much blood because of the internal bleeding that was taking place, that he had gout inside his knees, which he didn't know. That pain is what got us to the hospital before any damage could or was made to the kidneys or the liver. So had he not gotten up that night, he probably would have died in his sleep. But it was fate that we got him up and he had collapsed because of that pain. Because it is a bleeding disorder that most people aren't even aware of that they have unless they know what to look for until it's too late.
What were some of like the signs, the symptoms? Like, did they have any?
The signs were bleeding of the gums or nose or in your stool, reddish spots, pinpoint reddish spots on your legs, and flat areas of purplish flat areas of bruising.
What treatments have you undergone?
Well, the reason he was flown flight to life after the preliminary diagnosis here in Durango was that in those rare 20% cases that have survived, the reason behind that was that some doctor felt that if they could do a complete plasma transfusion, then the bone marrow can begin to regenerate some healthy platelets. And so that machine is called, or that procedure is called the plasmapheresis. And the machine that does that is located in Denver at that hospital and is the only machine within a 5-6 state radius around Colorado serving this part of the country. And of those 20% that I had earlier mentioned that had survived, it was those treatments along with a massive dose of steroids. They were able to survive. This treatment typically is required of an individual to undergo 30 to 50 times to get at least 30 to 50 transfusions before they could say they're producing the platelets normally. However, they've seen major regressions after this and reoccurrences within 3 years of this massive treatment. Your dad, again, was made medical history because he began to regenerate normal platelets after his first transfusion, and then after his second, he was up to normal, and his third time, they went ahead to give him one more, and the machine shut down, and he was good as gold. At least so they thought. They gave him also some prednisone steroids, 100 milligrams, in addition to that, and quite honestly, they don't know if it was the steroids that brought him back, the platelets, or if it was the transfusion. So he will remain a medical mystery to the profession once again. They did also replace some of his blood while I was at the hospital, but outside of that, that was the treatment that was utilized. As far as the care afterwards, he's been taking the steroids and has got to go for monthly blood exams.
How does this affect your overall?
Well, it really doesn't physically affect me at all. Mentally, it makes me aware that I may have an issue and what to look out for. So now I know that if I see the red spike, or if I start bleeding from the gums or the bruising or whatever, then I need to get in and get checked right away. And hopefully they can do another transfusion, take care of me. But it doesn't affect me. I just go on as normal. I mean, there's something in that system that people can, you can die any time. So nobody knows, when your time is up. So I just move on with life. But I know life's getting shorter, so I'm going to try and live a better quality life now.
Is there anything you could have done, maybe in the past or maybe in the future, to prevent these things from happening?
No, they don't, because they don't know what's causing it. They don't know what the origin is. There's nothing that we could possibly change in our lives to have prevented it. It was a fluke for when we just don't know why it occurred or how.